In this lecture, we're going to look at the brain. Now, the brain is part of the central nervous system contained in the cranial cavity of the skull, and it's a control center for many of the body's functions. And it acts like a very complex computer, but a whole lot more. Now, the parts of the brain include the brain stem, the cerebellum, the diencephalon, and the cerebrum. And then we have cranial nerves. And these cranial nerves are part of the peripheral nervous system that arise directly from the brain. Now, the brain stem, as you can see, connects the spinal cord to the brain. And its parts are going to be the medulla oblongata, the pons, and the midbrain. Now, the medulla oblongata, or just medulla, does quite a few things. It regulates heart rate, blood vessel diameter, which of course is going to control your blood pressure, respiration, swallowing, vomiting, hiccuping, coughing, and sneezing so you can rest medicine. Oh, I'm sorry. Sounded like a commercial there for a second. Again, it controls heart rate, blood vessel diameter, which is blood pressure, respiration, swallowing, vomiting, hiccuping, coughing, and sneezing. And then we have what's called the pyramids, which is part of the medulla. And there's an area of the medulla of the pyramids that if they were made out of clay, and then we just kind of smeared the two pyramids together in a little spot, we would have what we would call the pyramidal decussation. And these are where nerves are going to decussate. Now, what in the world does that mean, decussate? Well, it means to cross over. Remember that the right side of the brain typically controls the left side of the body. And the left side of the body controls the right side of the, the left side of the brain controls the right side of the body. And so there's got to be some areas where these neurons are going to cross over, and this is one of the places. Not all neurons cross over through the pyramidal decussation, but we'll see later on that there are some that do. And then the pons is going to be your sleep and respiratory center. Respiration is very complex. If you noticed, we have control of respiration within the medulla oblongata. With respiration, you have to know when to take in a breath, when to relax your breathing muscles so that you exhale, how deep to take in a breath, how fast to take in a breath. You're looking at rate, rhythm, depth, all that stuff, and it's controlled, again, in the brainstem by the medulla oblongata and the pons. So there's very specific centers that do the control. And when you get to the respiratory lecture next semester, then you'll see where these come into play. And then the midbrain is the integral part of the auditory pathways in the central nervous system. So taking a look at a brainstem and diencephalon that has been dissected away from the rest of the brain. Here we have the diencephalon, which is made up of the thalamus and the infundibulum. Now, the infundibulum is a little stalk that comes off of the diencephalon and is attached to the pituitary gland. And if you notice between the two thalami, we have what's called the interthalamic adhesion. Now, when we look at a brain that has been mid-sagittally sectioned, we'll see that interthalamic adhesion. I'll point it out at that time. And in the midbrain, you can see that we have the cerebral peduncles, and no, that's not a card game. Cerebral peduncle. And then the brainstem is going to be made up of the midbrain, the pons, and the medulla oblongata. And here are the pyramids of the medulla. And then here's that little area where it's kind of mushed together. That's the pyramidal decussation. Again, this is where neurons are going to cross over to the opposite side. And again, not every neuron. Some neurons do continue on down through the spinal cord and cross over at a different spot. Also, all of these little yellow things that you're seeing are the cranial nerves. There are 12 cranial nerves, which we'll cover in another lecture. Now, looking from the side view, what we're looking at, and let me just back up. Here's what we're looking at. Here's the brainstem. Right here is the cerebellum. If we cut the cerebellum off, right here's where we cut the cerebellum off. This is what we're looking at now. Okay. And actually this goes up a little bit higher. So we're actually dissecting it all the way around here and all the way up to here. Okay. And again, we can see some of the cranial nerves. And some of the parts again, we have the diencephalon with the thalamus and the pineal body or pineal gland. The midbrain contains the superior colliculus and inferior colliculus. Then we have the superior cerebral peduncle and the middle cerebral peduncle and inferior cerebral peduncles. And that is found in the pons. And within the medulla oblongata, we have the nucleus cuneatus and the nucleus gracilis and the olive. Looking at a posterior view, again, this is where, right in this whole area here, is where the cerebellum would be attached. When you remove the cerebellum, you see this hollow, empty area, which would contain cerebral spinal fluid, and we call that the fourth ventricle. Now, earlier we talked about in the brainstem, we have a vomit center. Well, again, this is where the cerebellum has been removed, and we see this little V shape. This is called the obex. There's not a label for it, but it's called the obex. And that obex is your vomit center. Now, why is that important? Well, because if there's a head injury and there is pressure either within the brain or pressure outside the brain, and it's pushing on this obex, especially if the brain is swelling, you might get pressure on that obex. And patients oftentimes with head injuries, with head trauma, might have projectile vomiting. And why would they have that projectile vomiting? Again, because this is the vomit center. And if there's pressure building up within the brain, it presses on that and you get that trigger, that stimulus. Now here's cerebellum. And it gets kind of confusing because you have cerebellum and cerebrum. Okay, and it's easy to confuse the two. Cerebellum is a bigger word, but cerebellum actually means little brain. So it's kind of the opposite. Okay, cerebrum is what you'd normally think of as the brain. It's the bulk of the brain. Cerebellum is the little brain, again, that's attached to the brain stem. So here's the cerebellum. Here's the brain stem. Here's the fourth ventricle. Okay. Now, when you think of cerebellum, think of posture and balance. Okay. If a police officer pulls you over and makes you stand on one leg and touch your nose or walk a straight line, they're actually doing a cerebellar exam. Okay. And so there are things that can affect the cerebellum, and drugs and alcohol are one of those things that can affect the cerebellum. Head injuries can also affect the cerebellum. And And when you see that, it's going to be very difficult for that person to walk in a straight line or to stand on one leg without falling over and so on. Because again, this is involved in balance, posture, locomotion, fine motor control, and fine motor coordination, producing smooth flowing movements. And that's going to be lacking if there's some impairment to the cerebellum. Now, when you're walking and you're staggering around, again, which could be a problem with the cerebellum, we call that ataxia. So ataxia. And here's how I think about it. If you've had a little too much to drink and you're staggering around, you don't want to drive yourself. What do you want to call? And don't say Uber or Lyft. You want to call a taxi. Eh? Okay, so ataxia. Next is the diencephalon. And the components of the diencephalon include the thalamus, the subthalamus, the epithalamus, and the hypothalamus. So right here, this large thing is the thalamus. And again, what connects the two thalamic bodies is this interthalamic adhesion, which is right there. The subthalamus, obviously, is going to be right under the thalamus. Epi means above, so here is the epithalamus. And as we come around to the end of the epithalamus, that's where we see the pineal body. We also have within that epithalamus the habenular nucleus. And then we have the hypothalamus. So here's the subthalamus. Below that is the hypothalamus. And here's a close-up of the hypothalamus. And you're going to see various nuclei. Here's the preoptic area. You have a paraventricular nucleus, a dorsomedial nucleus, posterior nucleus, and then a mammary body, which you can see from the outside of the brain if you're looking at the brain. And then here's the ventromedial nucleus and the supraoptic nucleus. Now, when we slice through a brain, we're not going to see these individual nuclei. It's going to look very smooth. Okay. But like I said, the mammillary body, you will see that. It'll look like a couple of little bumps just underneath the infundibulum. And again, the infundibulum is this stalk that the pituitary gland is attached to. Looking at a mid-sagittally sectioned brain, again, we have the thalamus. We have the subthalamus. Here's the epithalamus, this little line here that ends at the pineal gland. Okay. And then below the subthalamus, this triangle right here is going to be the hypothalamus. Now the infundibulum has been cut away. Okay. Now there's other structures in this particular section that you probably need to know as well. And that would be the corpus callosum. Okay, so this is the corpus callosum. Now the brain is not solid. It has hollowed areas, hollow cavities that we call ventricles. And in this case, there's a ventricle just beyond this membrane. This membrane is called the septum pellucidum. If we cut the septum pellucidum out of the way, we'll be in what's called the lateral ventricle. Okay. Another thing that we have here is this stuff, which is called choroid plexus. Choroid plexus produces cerebral spinal fluid. And that cerebral spinal fluid gets put into a cavity or a ventricle. And so with the two halves of brain put together, you're going to see a hollow area around the thalamus, except for where the thalami connect. Remember that interthalamic adhesion, which I don't know why is not showing up on this picture, but there would normally be an interthalamic adhesion right about here. So this fills up with cerebral spinal fluid, and we call that the third ventricle. So on the other side of the septum pellucidum is the lateral ventricle. In here would be the third ventricle. And that cerebral spinal fluid is also going to flow down through this canal, and we can call that a cerebral aqueduct, or we can also call it the mesencephalic aqueduct. As you can see here, mesencephalic aqueduct. And that drains into the fourth ventricle. Here we have the cerebellum. And it kind of looks like a shrub, doesn't it? Well, see this right here that looks like the branches of the shrub? That is called the Arborvitae. Now, there is a shrub called an Arborvitae. And what does arbor mean, first of all? Arbor means tree. Vitae means what? Life. So Arborvitae means the tree of life. And what do trees and shrubs have on the ends of their twigs? They have leaves or foliage. See how these look like they have like leaves? Well, we call those things folia. So again, like trees have foliage, these are the folia. And let's see, what else do we have? Here's what we call an anterior commissure. Commissure is a connection. And then here is the fornix. Fornix means arch. So this is the arch or fornix. So again, looking at the diencephalon, the thalamus is going to be the largest part of the diencephalon. Most sensory input projects here and it influences mood and actions such as fear or rage. Think of the thalamus as kind of a filter because you are being bombarded by outside stimuli. You're probably not even thinking about or realizing, the feeling of your clothes up against your skin, unless you're wearing something very uncomfortable, but you don't really notice, if you're wearing socks or the shoes that are on your feet or your pants, or shirt or blouse that are touching your skin. Typically, we kind of filter those sensations out. Okay. There's constant sound and other stimuli that are coming in that, again, we would be overwhelmed if we were aware of all of those sensations that we're taking in. And so the thalamus helps to filter that out. It acts as a filter. Okay. The subthalamus is involved in controlling motor functions. The epithalamus, we have the pineal gland or pineal body again that may influence the sleep-wake cycle. The pineal gland is what makes melatonin. And so people that have a hard time sometimes getting to sleep will take melatonin. Or if you travel, to another country, overseas where you're crossing the international timeline, that can really throw off what we call your circadian rhythms and mess with your pineal gland and mess with that sleep-wake cycle. And again, this is another reason some people take melatonin. The hypothalamus has a whole bunch of functions. It has autonomic nervous system control, endocrine control, muscle control, Temperature regulation. This is where your body's thermostat is. This is what keeps your body running at around 98.6 or 37 degrees Celsius. The other was Fahrenheit. This isn't what creates the temperature, but this is what regulates the temperature. Just like a thermostat on a wall. That's not where the heat is coming out of. That doesn't generate the heat. Your furnace does. The thermostat just regulates that heat. So this helps to regulate, like a thermostat, your body temperature. Also, this is where your hunger and thirst centers are. So it helps in regulation of food and water intake. Also plays a role in emotions and regulation of sleep-wake cycles. Now here's the cerebrum, and again, this is the largest portion of the brain. So all of this is cerebrum. That's why I was saying when you think of the brain, you're most likely thinking of the cerebrum. Here's the cerebellum. Remember, that means little brain. Okay, and if you want to be kind of passive aggressive and, kind of diss somebody, but make them think that you're complimenting them, you say, well, aren't you the cerebellum? They'll think you're calling them brainy, but what you're saying is, ye of little brain. Okay, just saying. And so anyway, it is the largest portion of the brain. Divisions, we have a right side and a left side, or what we call hemispheres. So the right hemisphere and left hemisphere. And then there's going to be lobes. And we have a frontal lobe, we have a parietal lobe, we have an occipital lobe, and we have a temporal lobe. Does that sound familiar? If you learn the skull, then it should. And these areas of the brain are going to fit into those areas of the skull. And then the cortex is going to be the outermost surface. And it's going to be quite thin, actually. In the brain, the cortex is going to be gray matter. The bulk of the brain is going to be the medulla. Or I should say the bulk of the cerebrum is going to be the medulla. And that contains white matter. So what's the difference between the gray matter and the white matter? The gray matter contains non-myelinated axons. And what's myelination? Again, that's this fatty coating that's wrapped around axons to insulate it. Okay, so we covered that earlier. So the cortex has unmyelinated axons and nerve cell bodies. The medulla, because it's white matter, and what makes it white? Well, what's myelin made of? It's made up of fat. Okay, so the medulla is going to be mostly myelinated axons. Okay, so if somebody tries to insult you and say, oh, you're a fathead, well, I take that as a compliment, because that means if there's more fat, there must be more brains there. At least more than what they are if they're trying to insult you. Anyway, now within the cerebral cortex, we have things called gyri, a singular as a gyrus, sulci, or fissures. Now, a gyrus is kind of like a squiggle on the brain. You noticed how the brain is all squiggly looking? That would be the gyrus. In between the gyri are these depressions called sulci. And think about it like this. If you're depressed, what do? You sulk. So sulci are depressions in between the gyri. Or you might have some really large sections, depressions. Again, these are going to be fissures. And so some major structures that we're going to look at are the longitudinal fissure, which separates the two cerebral hemispheres. So we see that groove going down the middle of the brain to separate the right and left halves. Now we need a landmark to be able to name these gyri. And yes, it's not just random squiggles. They are very specific, and they have a certain function, and they do have specific names. And so one of the landmarks that we look for is what's called the central sulcus, and that separates the frontal and parietal lobes. Now the temporal and occipital lobes are also bounded by sulci. Now looking at motor and sensory areas of the cortex, the primary motor cortex of the precentral gyrus directs voluntary movements. Okay, so precentral gyrus, motor. The primary sensory cortex of the postcentral gyrus receives somatic sensory information, such as touch, pressure, pain, taste, temperature, vibration, things like that. And so you want to think of the postcentral gyrus as sensory. So looking here, here's our central sulcus. This is the front or anterior portion of the brain. This is the posterior portion of the brain. Again, central sulcus. What's the prefix we use for before? Well, it's right there in the name prefix. It's pre. So this gyrus is the pre what? It's pre to the central sulcus. So it's a precentral, and it's a squiggle. So a squiggle's a gyrus. So this is the precentral gyrus. And again, the precentral gyrus is for motor. That's your primary motor cortex. Now this comes after the central sulcus, so it's post. Post means after. Post what? Post-central, and it's a squiggle, so gyrus, post-central gyrus. And this is your primary sensory cortex. So when you look at this, I think of MS, or Ms. brain. So this is the brain. No, this is Ms. brain to you. M for motor, S as in sensory. Okay, going from anterior to posterior. All right. Now there's some things that we're going to look at in another video that shows the function of a lot of these different lobes, but I'm going to go over it a little bit right now, since we've mentioned that this is primary motor, this is primary sensory. Now, you ever had a parent or a teacher tell you, you know what, I've got eyes in the back of my head? Well, you kind of do. This is your occipital lobe, and this is where your visual cortex is. So everything you're seeing with your eyes has to go all the way back to the occipital lobe in order to process what that brain is seeing, what your eyes are seeing. So really, you're seeing with your brain. This is why patients who have hallucinations, either auditory hallucinations or visual hallucinations, they're just as real as anything we would hear or see that's not a hallucination, because where is hearing? Where is vision? It's in your brain. Okay, so why couldn't the brain come up with, these visual or these auditory things that you would swear were real? Okay, so this is the visual cortex, and it's one thing seeing something, and it's or hearing something, and I keep talking about hearing. So let's look at the temporal lobe. Here is your auditory cortex, and then but again, it's one thing hearing it and seeing it, but we have to know what it is we're hearing or we're seeing. Like, for instance, if someone has been deaf all of their life, and maybe they get a cochlear implant, and now they're hearing for the very first time in their life, well, it's one thing hearing sounds, it's another thing knowing what it is you're hearing. While I was lecturing here, and I don't know if it was picked up by the microphone, but I heard a police car go by, okay, with the sirens on. Okay, so I heard that sound, but I could associate that with what I was hearing, some kind of an emergency vehicle, either a police or an ambulance. Okay, so I was able to associate that. Same thing with visual. It's one thing to see things, but it's a whole different thing to know what it is you're seeing. Okay, and that's where these associations areas come in. Okay, so here's the occipital lobe visual cortex. Here's your visual association area. Here's your auditory cortex. Here's your auditory association area. If we pry apart this fissure right here, okay, pry it apart, we see inside the olfactory cortex. So what's olfaction? That's the sense of smell. Olfactory, I think of a smelly old factory. Okay, where I grew up, right across the street from my elementary school, was Argo cornstarch, and they made cornstarch. And when they were in the process of making the starch, you could tell on that day when they were manufacturing, because it was smelly. So there was this big old smelly factory. So that's how I remember olfactory is your sense of smell. Okay. And another thing here, look at that. It looks like a purple tongue, doesn't it? Oh, wait a second. It's the gustatory cortex. What is gustation? Gustation is taste. So there was a reason I called that a purple tongue, to help you remember that gustation is taste. Now, if you notice, this area of the brain is kind of insulated, right? You have to pry this apart to get to it. So this part of the brain is called the insula. See how it's insulated? So the insula. Or if you like to eat ensalada, okay, there you go. Ensalada, ooh, tastes good. So there's your gustatory. The precentral, or prefrontal cortex, I should say, this is pretty much determines who you are. This is you, okay? And it's kind of weird when I put it this way, because when I say I, it's really my brain that's saying I, right? And my brain is actually talking about itself in third person. Isn't that bizarre to think about? So, again, when you say my brain, it's my brain that's saying my brain. Anyway, not to get all confused, but this prefrontal cortex is who you are. That's why with like highly aggressive or violent people in the past, they would do frontal lobotomies, where they would go in here, kind of scramble the neurons up a little bit in this prefrontal gyrus, and basically kind of destroy their personality, so that hopefully they would not have those violent tendencies. Okay. Matter of fact, there's a book out there, if you're interested in this stuff, that's called My Lobotomy. And a guy tells a story of how his stepmother wound up taking him in to get one of these frontal lobotomies. And the book is basically him trying to figure out why did this happen to him. And it was kind of an interesting book. There's another book out there too that's a classic, that's called The Man Who Mistook His Wife for a Hat. Okay, The Man Who Mistook His Wife for a Hat. And I'll put a link for that on my YouTube channel here. So I'll put a link on that below. But very interesting, classic book. And each chapter is a different neurological disorder. and it's told in story form by a neurologist. So, great book if you can get it. Okay, then we see this little guy here. He is a homunculus. So what the heck is a homunculus? Well, homunculus literally means little man. Okay, that's what that means. And so if we do a coronal or frontal slice through the brain, right through that precentral gyrus, and what did I say the precentral gyrus was? Oh yeah, it was your motor sensation. Well, we're going to be able to map out the brain as to what area of the brains control what part of the body. And if we go right in the center of the brain, I wish this was turned facing. Here, let me go to the next slide. So it would be like right here. So this would be like your toes tucked in here. Here's your leg, your hips come over, and, you know, all the way down here. So here's where the toes are, your ankles, knees, hips, trunk, shoulder, elbows, wrist, and then all of a sudden the hand takes up a big chunk of your brain. Why is that? Again, think of the brain as a hard drive on a computer. If you're putting programs onto your computer, there are some programs that are very small. They're not very complex, so they take up a very tiny portion of your hard drive. Other softwares have a much higher level of complexity, in which case they're going to take up a lot of the hard drive space. Think about your toes, your ankles, your knees, your hips, your shoulders, your elbows, your wrist. How precise are they? Not very precise. Okay. But if you go down to fingers, and if you notice how small of a motion you can move and how precise you can get with the hand, think about, well, we're talking about the brain. Think about neurosurgeons. You know, just how skilled they are, you know, with their hands, the amount of complexity in the movement of their hands. Okay. So since the hand is very complex as far as movement and everything goes, it's going to take up a bigger chunk of your hard drive. Okay. It's going to take up more of the brain. Same thing with the head and the face, and also the tongue. Okay, it takes up a huge chunk of the hard drive as well, because the head contains organs of special senses. You know, you have to move eyes around, you have to work the mouth for eating, for, you know, chewing, swallowing, communicating, talking, all of that stuff. So it again, very complex motions there, and so it takes up a big chunk of your hard drive. Now, if we take these in the proportions your brain is using them and assemble them, this is what we get, this homunculus. Notice how huge the hands are, okay, because it takes up a big chunk of the hard drive. The head also takes up a big piece of the hard drive, and everything else doesn't take up quite as much, right? So head and hands take up the most. And don't make fun of him. He'll punch you, and that would hurt. Okay, looking at the basal nuclei and the limbic system. The basal nuclei is basically motor function control, whereas the limbic system, think of emotions. That's your emotional brain. It's for basic survival, functions as memory, reproduction, nutrition. Again, it's your emotional brain as well. And what else? We call this the kind of the reptilian brain. as well. But anyway, going back up here, looking at the basal nuclei, that's made up of what's called the corpus striatum. And the corpus striatum is made up of the lentiform nucleus and the caudate nucleus. So lentiform nucleus and caudate nucleus. Lentiform. What is a lentil? It's a little bean, right? Well, look. Looks like a lentil. Put it in some water, it sprouts. And then we have the caudate nucleus. And then that comes around, and you have the amygdaloid nucleus as well. But so that's the basal part of the basal nuclei, the corpus striatum portion. Then we have the subthalamic nucleus, which is also part of the basal nuclei, and the substantia nigra, which is in the midbrain. Substantia nigra has an important clinical aspect to it. In patients with Parkinson's disease, you'll notice that the substantia nigra is very diminished, and that's probably plays a role in some of the tremors that those patients have. The limbic system. Some of the things with the limbic system are going to be the olfactory bulb. Think about that, olfaction, sense of smell. You know, certain smells are going to give you emotional responses, right? And, you know, you might smell, you know, an apple pie and you might think, oh, wow, that's just like what grandma used to microwave. Okay, you guys are young. You're grandma's probably my age, but my grandma would have baked the pie, so I would have thought of that, just like what grandma used to make. Okay, or you might smell a perfume or a cologne and think of a certain person that you knew at one time. So there's a lot of emotion and memory that goes along with the sense of smell. So let's just kind of go around here. We have the anterior thalamic nucleus. Okay, here's the fornix. What else? The habenular nucleus right there. We have the hippocampus, which contains the dentate nucleus. And dentate, if you go to the dentist, what do they work on? Teeth. Oh, look at this. See how it looks like little teeth? Okay, so that's the dentate nucleus. And then we have the fimbria. Fimbria means finger-like. Doesn't show up too well, but yeah. And then the amygdaloid nucleus. And the mammillary body. And again, the olfactory cortex, olfactory bulb, the septal nucleus. So all of that is part of the limbic system. And now looking at the cranial meninges. Now meninges, they may not sound familiar, but what do we call the inflammation of the meninges? Meningitis. So you might have heard of meningitis. Well, the meninges cover the brain. They're the connective tissue membranes that help to protect the brain. Okay, and what do you do if you're trying to protect something? Like, for instance, if you're moving and you have a table that you don't want to get all dented or scratched, what might you do with that? You might pad it. Okay, so pad, P-A-D. So the meninges are the padding for the brain. And the reason I put it in this way, pad, going from the inside out, is just to help you remember. So the P is the pia mater, and that's bound tightly to the brain. So this would be the pia mater layer. And again, that's right up against the brain. If you're dissecting a brain, it'll look just kind of like, I don't know, little fibers, kind of stuck to the brain. You have to take your forceps and just kind of pick it off clean. Okay, the next one is going to be the Arachnoid Mater. Okay, Arachnoid Mater. What's an arachnid? Oh yeah, spider. So this area here, look at this. It looks like a spider web, a cobweb. So if you're like, oh, I've got cobwebs in my brain in the morning. Yeah, right there. There's your cobweb. It's the Arachnoid Mater. Okay. And then next, we have the Dura Mater. So here's the Dura Mater. Now there's two Dura Maters. You have the meningeal layer, which is what we're talking about here with the meninges. But then you also have one that's fused to the inside of the skull, and that's the endosteal layer. So, you know, if you're, again, dissecting a skull, you know, and you've cut the top off and you remove the brain, and as the bone begins to dry, this begins to peel, and then you have to peel it the rest of the way off of the skull. So that's that endosteal layer. But going back to this, Dura Mater. What does dura mean? It sounds like what? It sounds like durable, strong, tough. Okay, it's very tough. If you have a piece of this Dura Mater and you try to tear it, you can't because it's tough. So the literal translation, oh, wait a second, what's mater mean? So anybody out there, what's mater? Nothing. What's mater with you? No, anyway, what's mater? Think of your alma mater. Okay, mater means mother. And so Dura Mater literally means tough mother. And like I said, it is. If you try to tear it, it's not going to tear. So again, very tough. Now there's going to be spaces in there. We have the subdural space. Okay, so the subdural space is going to be right up under the dura. So here's the Dura Mater. Here's the subdural space. Now what we find in the subdural space is serous fluid. Now with a head injury, sometimes blood can fill up in this area and we get what's called a subdural hematoma. Subdural hematoma. In which case they'll have to drill a little burr hole and possibly stick a little needle in there to drain that blood out of there. And then in the subarachnoid space, and that's all the little spaces in between the cobwebs here, that is going to be filled with cerebral spinal fluid. Okay, so subdural space is just serous fluid, and subarachnoid space is cerebral spinal fluid. Okay, and as I mentioned before, that the brain is not solid, it is hollow. And those hollow areas are called ventricles. And in each of the two hemispheres, you have the lateral ventricles. So here's the lateral ventricles. And here's the anterior horn of the lateral ventricle, the posterior horn of the lateral ventricle, and the inferior horn of the lateral ventricle. And so these ventricles are filled with cerebral spinal fluid. So the cerebral spinal fluid in the lateral ventricle can then flow through what we call the interventricular foramen. I think the old term is the foramen of Monroe. And that flows into the third ventricle. So this is the third ventricle. See, it looks like it has a little eye. Here's a beak. Looks like a bird, right? Bird with big feathers. So here's the bird head. Here's the bird beak. That eye is the interthalamic adhesion. Okay, so obviously fluid can't flow there because it's solid, so it flows around it. And again, this is the third ventricle. And then the fluid will flow through this, which again is the cerebral aqueduct or the mesencephalic aqueduct, and it'll drain into the fourth ventricle. Now here's the thing, the spinal cord is also hollow with that central canal, and so right here it can continue on to flow through the spinal cord. And as I mentioned before, the choroid plexus produces cerebral spinal fluid, which fills ventricles and other parts of the brain and spinal cord. You're going to find the choroid plexus in the ventricles. So you'll see some just above the epithalamus. You'll find some in the lateral ventricles. You'll find some down in the fourth ventricle. So the cerebral spinal fluid, or CSF, it's similar to serum with most of the proteins removed. It bathes the brain and spinal cord, and it provides a protective cushion around the central nervous system. Also provides some nutrients to the central nervous system tissues. And it is produced by what we call ependymal cells. So ependymal cells make up the choroid plexus. The choroid plexus makes the cerebral spinal fluid. So again, if we look at the flow, here's choroid plexus made up of ependymal cells, which produce the cerebral spinal fluid. Here's the lateral ventricle. Okay, and then here's the opening here, which flows then into the third ventricle, which then flows through the mesencephalic aqueduct or cerebral aqueduct into the fourth ventricle. Okay. Now there's some openings in the fourth ventricle that allow that cerebral spinal fluid to flow out. Some of it's going to flow down through the spinal cord and out, but in the fourth ventricle, it's going to flow out and surround the brain. So the brain is has cerebral spinal fluid both inside and outside to give it protection. And these openings, we have the lateral aperture, we have the median aperture, and we have one more aperture, and I'm not seeing it on this particular picture. But anyway, we have the lateral and median apertures that allow for flow of that cerebral spinal fluid out. Now, as that cerebral spinal fluid surrounds the brain, and the choroid plexus is constantly making the cerebral spinal fluid, well, after a while, don't you think a lot of pressure is going to build up inside the skull? Well, what happens is, and if we just take a little piece of the brain here and we enlarge it, we have these things right here, which are called arachnoid granulations, and they act as kind of a one-way valve. So as cerebral spinal fluid pressure starts to build, it vents some of this excess cerebral spinal fluid into the sinuses. This is the superior sagittal sinus. Okay, and then we have like the straight sinus and what have you. Yeah, there are these. It's basically a venous system, you know, of venous blood coming away from the brain. And again, that excess cerebral spinal fluid will be vented out into those sinuses. Now, what do you think would happen if these apertures were not formed yet? Okay, so during development in the womb, you know, these are either too small or they just haven't opened. What do you think would happen? Would the choroid plexus just stop making cerebral spinal fluid? No, it would continue on. And then we wind up with this condition right here. And this is hydrocephalus. Okay, so this infant has hydrocephaly. Okay, and so basically they're not venting out that excess fluid, and so the brain has become quite enlarged. And what's going to happen is they're going to have to go in surgically and put a shunt into those ventricles to shunt that excess fluid away. And it depends on what type of shunt they use. Sometimes the shunt is actually run up under the skin and it empties into the abdominal cavity, and there it's just reabsorbed by the body. Sometimes it goes down and vents into a blood vessel. But again, that's a way to reduce, the size of the brain, because if you have that constant compression, you're going to have brain damage. And because the infant's skull has not fused yet, that will cause the skull to become quite enlarged. And so here's an example actually of a hydrocephalic skull. And you can see that it's much larger than a typical skull. And here, I'll give you a comparison. Okay, so hopefully you can see that. The skull is a lot larger, much more bulbous looking. This is only a half a skull here. Let me put that back down. Okay, but you can see just how large this particular skull is compared to a normal skull. Okay, so quite large. And so looking at the brain blood supply, the brain requires a tremendous amount of blood. It receives 15 to 20% of blood pumped by the heart. Again, 15 to 20% of the blood pumped by the heart. Interruption can cause unconsciousness and irreversible brain damage. The high metabolic rate and dependence on constant supply of oxygen and glucose makes it very important that this blood continually flows, is pumped to the brain. And the brain receives blood through arteries. Then we have what's called the blood-brain barrier. This is capillary endothelial cells along with astrocytes and basement membrane. And it's to be considered when developing drugs. Now, again, these astrocytes will reach over and kind of wrap almost like a little foot around the capillary. And there's many of these projections that almost, it's like laying tile down. So we're putting tile over these capillaries. Now, anything going through the capillary, before it can get to the brain, it's going to have to go through the astrocyte itself. Okay. Now, here's the thing. If you're creating a drug to treat the brain and it can't cross the blood-brain barrier, then it's not going to be very effective for the brain. An example would be like an antibiotic, for instance. If you have a brain abscess, an infection in the brain, it's going to be very difficult getting that antibiotic to the brain. Oftentimes it might have to be put in spinally, where they'll have to do a spinal tap and put the antibiotic into the cerebral spinal fluid and allow that to flow up to the brain. And there are many things that can cross the blood-brain barrier quite easily. For instance, organic solvents. This is why, if you read like a can of paint, spray paint, that it says to work in a well-ventilated area, as well as a lot of other chemicals. And it's because these solvents can cross the blood-brain barrier rather quickly. And that's why you experience dizziness sometimes, or other side effects as well, headache. It's because of its ability to cross that barrier. Alcohol is another thing that crosses the barrier rather quickly and reaches the brain and can affect the brain. Okay, looking at formation of the neural tube, which will eventually become the brain and spinal cord, we have the neural plate here. And you notice there's blue and there's some yellow. Here's blue, blue, yellow. Okay, so looking at the neural plate, we have what's called the neural groove. Okay, and here's a neural fold, as well as a notochord. By the way, any idea what the notochord becomes later on? A lot of people think it's the spinal cord, but it's not. Actually, the notochord becomes your vertebral bodies. And there's a little thing that sometimes shows up on X-ray where it's kind of, it's almost like a little pocket within the vertebrae. It's called a Schmorl's node. A Schmorl's node is just remnants of the notochord. All right, so going back, here you are, you're looking like an appetizer, you know, a shrimp cocktail here. And that neural groove deepens and begins to fold over. Okay. And then the crest of the neural fold is right here. And then we have some neural crest cells. And then eventually this closes up. And here you can see it closed up now. And the outer layer is going to become skin. Because remember, skin is part of the neuroectoderm. Okay, so that's where this stuff is forming from, the neuroectoderm. Okay, so we have the skin, we have the neural crest cells, and then we have this neural tube. This neural tube is going to become the brain and the spinal cord. And again, if we're low enough, this notochord will become vertebral bodies. Okay, so let's look at development of brain segments. When you're at this stage, okay, you have what's called a proencephalon, and you have these optic vesicles, which are going to become eyes, mesencephalon and rhombencephalon in the spinal cord. As you develop a little further along, then you're going to get the telencephalon. And again, we have these optic vesicles here, the diencephalon, the mesencephalon, the metencephalon, the myelencephalon. So that takes care of the brain. And then we have the spinal cord. So how in the world are you going to remember this in order? Well, here's how I remember it. It's tel die, you know, somebody named Diane, tel die, mes met my sister. Okay, tel die, mes met my sister. And the sister is spinal cord. So let's see what these become. And again, that's when you're at this stage. You look kind of like one of those animal crackers. So the telencephalon is going to become the cerebrum. Okay. The diencephalon, you'll never guess what that's going to become. Yes, it's going to become the diencephalon. Mesencephalon. Now, meso means middle. Meso means middle. So the mesencephalon is going to be the middle, and then cephalo means brain. The middle brain, oh, the midbrain. So there we go, midbrain, mesencephalon. Okay. And then the metencephalon is going to be the pons and the cerebellum. So the metencephalon is the pons and the cerebellum. So it's almost like it's, you know, it's coming down, folding in half, and then we get our pons. So again, from the metencephalon. And then the myelencephalon becomes the medulla oblongata. I guess you could think of, oh, that's hurting my medulla oblongata. listening to all of this. Actually, it wouldn't, but anyway, one way to remember. So, again, that's the myelencephalon, and then you have spinal cord, of course, coming down.